All right, let's turn our focus to this now. The Gauteng Health Department has confirmed that an internal investigation cleared Westbury Clinic in Johannesburg of any wrongdoing in the death of a 32-year-old Miriam Singh, an expectant mother. Singh passed away within an hour of being admitted to the clinic on Sunday. The department's investigation found that the healthcare workers followed the correct protocols. A post-mortem revealed that Singh had a serious underlying condition which contributed to her rapid decline. The department has shared these findings with the family but is unable to disclose further medical information due to privacy policy between doctor and patient. The incident sparked a protest outside the clinic on Tuesday, with the community demanding answers. All right, to speak more on this, let's now welcome Gauteng Health Spokesperson Motalatale Modiba. Mr. Modiba, thank you so much for your time this afternoon, and a very good afternoon to you. Take us through the steps that were taken by the Gauteng Health Department in this investigation that led to your findings, essentially clearing the Westbury Clinic.
Thank you, Unati. We want to, I think, once again, pass a message of condolences to the Singh family. It is never easy to lose a loved one under any circumstance. And I think giving ourselves as healthcare workers, any loss is a loss too many. So we continue to avail forms of support in terms of counseling, in terms of just taking them through the redress, and to also help them to make sense of the report that is before us. But essentially, following the incident, after the patient was admitted on Sunday, the 29th of December, and subsequent to their demise, we immediately instituted an internal investigation. We've got a quality assurance unit that assists us whenever there's this kind of incidents to be able to investigate. But then we went a step further this time as well to say, over and above the work that the quality assurance unit would do to look at the clinical treatment that the patient was given, to look at all those other factors that might have contributed towards this situation that we find ourselves in. So we then subjected that, once that they done that work, we subjected that to expert review by bringing in our experts when it comes to obstetric and gynecology services. When it comes to surgery as well, we brought two experts on board to then also review all of that and look at that, and obviously ask some hard questions to say, if this was under a different health institution and different circumstances, would the outcome have been different? Of course, on the side as well, there was the post-mortem part of things. Given that there's a death, the police had to get involved in all of those things. And we now know that the post-mortem report came out also indicating the serious underlying condition that contributed towards the rapid decline of the patient's condition. And yesterday, the investigating officer went to the family to share with them the post-mortem report, because by in terms of our protocols and by law, it is the investigating officer that can then divulge that the outcome of the post-mortem report to the family.
Let me stop you. Let me stop you there. Let me stop you there before you talk to us about what the family has said. We do, of course, as you said, understand that you can't reveal Miriam Singh's medical records. But speak to us about whether or not this serious underlying condition that you speak of was in fact revealed to the clinic, because we do know and we understand that her condition deteriorated within an hour of her entering that clinic. And perhaps unpack the protocols that you speak of that were followed by the clinic the minute the deceased sought help.
Look, the patient that we're talking about is someone that was 9 months pregnant, meaning that they were at a stage of giving birth at any given time. So obviously when they presented symptoms of someone that is about to go into labor, and the necessary protocols were applied. I think the report that we got is that they were seen a couple of times, and the healthcare workers on site tried to ensure that they offer the necessary clinical intervention in this particular incident. Unfortunately, the underlying condition is not something that was known at the time of attending to the patient. patient, and it's now known in hindsight, given the benefit of the post-mortem and the tests that are done post the fact, that obviously that then also gives you a sense of and hence we needed to bring in this expert opinions to be able to examine, to say, given this underlying condition, is it something that was material that in a different setting, in a different facility, maybe the different treatment, you could have had a different outcome, and they came to the conclusion of saying, given the nature of the underlying condition, you would not necessarily have had a different outcome.
Yeah.
So it's something that currently we engaging with the family just to try and explain to them in detail the situation. It's obviously a difficult period. It's something that is difficult and unexpected from their side as well. So it's going to take time to obviously digest all of this and come to a place where maybe we could say this closure.
So just pick up from there then, your investigator went to the family. I know you're saying that it is a difficult time and they are still processing the findings, but have they accepted the findings of your investigation, or have they indicated that they will be taking up some next steps? What happens now?
It's not our investigator that went to the family. It's the investigating officer from the South African Police Services. Okay. Remember that there is now a post-mortem. So by law, no one else can reveal the outcome of that, because remember there was an inquest in terms of the circumstances around the death of the patient, and based on that, the postmortems had to be conducted. And when the outcome of that is then handed over to the SAPS by the forensic pathology team, and that's why even in this instance, it is the investigating officer who would have gone to fetch the results, and then also gone then to inform the family, say, from the post-mortem that had to be done as part of our investigation, this is the outcome that came from that. In terms of the next course of action for the family, I suppose that is something that they're still going to obviously decide on. It's not something that one can be able to speak on their behalf, but our interest in this case is to ensure that we walk the journey with the family, to find each other, but to also help them to come to terms, not just the family as well, but including the healthcare workers at the Westbury Clinic. It's important that we take them through a debriefing as well, because it's not an easy thing to lose a patient in this way. And we know that you've mentioned other things that have already happened. There's been remarks that have been made in the public domain, there's been protests and all of those things. So it's important that we assist the family on one side, but on the other side as well, we assist the healthcare workers so that they are able to also maintain focus, that the work that they need to do, there's still other patients that needs to be provided with care.
Mr. Modiba, we're running out of time. We're running out of time, Mr. Modiba, but I want to just take you on that last point that you've raised in terms of the concerns that were raised during that protest. We, of course, understand that it's probably a very sensitive time for the healthcare workers too, but there are reports that a resident within that protest in the area saying that the clinic has a history of malpractice. Your response as a department on that?
If I think when you were playing your clip now, you actually showed a plaque of the 17th of May when this new unit was opened. There's been quite a lot of work that has been done in that particular unit, clinic. One, the launch of the Save with a Smile program there, but secondly, to also improve the working condition around the particular facility. Hence, I think in your clip there, you showed last year when we went to the Western Clinic, but to open this very same midwifery and obstetric unit, because there's an investment that both the provincial government working with the city of Johannesburg have been doing in the particular facility to uplift the conditions there, to ensure that it serves as a facility that can also alleviate your Rahima Musa, which is also a facility dedicated to mothers and children. And we then are increasing capacity by ensuring that we have all these other facilities. So the challenges that communities might be raising are things that we have been continuously working on those. And I don't think those are the contributing factor in this particular instance. Granted, there would be challenges, but in this particular case that we're dealing with, those challenges would not necessarily have been a factor, given the type of report that is coming out that is giving us a bit of a better picture in terms of what could have been some of the challenges that led to the unfortunate outcome that we're now discussing.
All right, thank you so much for your time. Let's leave it there for now. Motalatale Modiba is the Gauteng Health Spokesperson there for us.